A hypothyroidism natural treatment sounds like a great idea, doesn't it? But what is the natural treatment? And are you sure you actually have hypothyroidism? Or that your lab test was accurate? Stay tuned and I'll give you a way to help your doctor out. I'm Dr. David Dahlman for DrDahlman.com. A hypothyroidism natural treatment involves two concepts: diet, and if you truly need a medication, a natural medication that your doctor probably hasn't told you about. Most hypothyroid patients probably take Synthroid, which seems to be the medication of choice for all with thyroid problems, whether you suffer from hypothyroidism or hyperthyroidism. If you've been diagnosed with hypothyroidism or suspect it, begin with a change in diet and some nutritional supplementation to make sure you are getting the vitamin and mineral building blocks that will help your body build your thyroid hormones. If you eat a poor diet, you may be deficient in these essential nutrients. Within your daily diet, emphasize foods high in iodine and selenium. Common foods that contain iodine are cod, eggs, fish, iodized salt, kelp, and seaweed. Common foods that contain selenium are Brazil nuts, brewer's yeast, liver, tuna, and other oily fish, sunflower seeds, lentils, and cashews. Additionally, a dietary supplement that contains iodine and selenium, as well as other synergistic vitamins and minerals, is recommended. Please visit my secure online store at DrDahlman.com and take a look at a dietary supplement called Thyrosol. This dietary supplement supports the synthesis of thyroid hormones and the conversion of T4 to T3, the main thyroid hormone. Now, if you have been diagnosed correctly with hypothyroidism, perhaps you do need a medication to live a comfortable life, and it's not Synthroid, which contains only T4. I'll tell you more about T4 in a moment. But have you really been accurately diagnosed with hypothyroidism? The laboratory test commonly used by traditional doctors is usually not thorough enough, and regardless of the highs or lows of the test results, they are interpreted as you needing thyroid medication. And it's the same medication, whether it's high or low, it's Synthroid. Please read my article at DrDahlman.com by clicking on Laboratory Tests on the left side of my website, and then choosing my article about thyroid tests, to learn more about which test to choose and how to interpret the results with more accuracy than your doctor. So, if you've taken the right test and it's been interpreted properly, you've tried diet and supplements, and you find you do still need medication, there are a number of natural thyroid medications available. Armour Thyroid and Nature Throid, which is also known as West Throid, are the most well-known, but the majority of traditional physicians don't prescribe them. Armour, Nature Throid, or West Throid all contain natural T3 and T4. Talk to your natural thinking physician, or just contact me at DrDahlman.com for more information about these natural medications and my advice about designing a complete protocol for you. And please read my article about the correct lab test I mentioned earlier by clicking on Laboratory Tests on the left and then on Thyroid Tests. It will also explain the function of your thyroid and define TSH, which is thyroid stimulating hormone, and also T4 and T3. I know it sounds confusing, but it's an easy explanation once you read it. Don't suffer from a misdiagnosis. Get the help you need, the right lab test, and the right medication if you need it at all. This is Dr. David Dahlman for DrDahlman.com. To read more information and view additional videos about natural therapies for many chronic health conditions, please visit DrDahlman.com.